Scientists say there's been a strong decline in the number of COVID infections in England since the latest lockdown began. It's working, it seems. Researchers at Imperial College, who've been tracking the pandemic, say infection rates have dropped by 2/3. But there are warnings that virus levels are still high, particularly among the under-25s. Here's our medical editor, Fergus Walsh.
Lockdown is working. Draconian restrictions on society mean coronavirus has fewer chances to spread. But that's meant closing schools, shops, pubs, gyms, putting normal life on hold. The latest evidence comes from 85,000 swab tests sent out to households across England. The survey by Imperial College from the 4th to 13th of February is good at picking up cases among those who don't know they're carrying the virus. The survey found that infections have fallen by 2/3 across England in the past month and are down 80% in London. The researchers estimate that infections are halving every 15 days, but they warn that prevalence of the virus is still high, with 1 in 200 people across England thought to be positive, similar to levels seen in September.
We know that the prevalence of the virus was much lower last summer, something like 10 times lower. And clearly, the more people who have the virus, and some of them will not have symptoms and not know they're carrying the virus, the more likely it is to transmit to other people. So the lower we can get the prevalence, the better.
There are still nearly the same number of COVID patients in hospital as at the first peak in April last year. But there are now tentative signs that vaccines are beginning to save lives among the over 80s, the first to receive a COVID jab. Deaths among the over 80s have fallen by 54% since the middle of January. Much of that is due to lockdown, but they're falling faster than in younger age groups, where they're down 45%. As more and more people get vaccinated, that should start bringing down cases as well as deaths.
At the minute, the over 70s, they only make up about 10% of cases, but over 80% of deaths. As we start vaccinating younger people, that effect that we're seeing in deaths, we should also start to see more and more in cases.
But there are concerns about the lower take-up of vaccines among Black, Asian and minority ethnic communities.
Thank you.
You may not always trust what you hear and what you see, but you can trust the vaccine.
A video urging people from all ethnic backgrounds to get the vaccine is being shown across commercial TV channels, and the NHS will be distributing leaflets in 20 different languages to try to dispel myths about the vaccine.
Thank you.
The vaccines do not contain animal products or fetal products. They do not affect your fertility. So if you are offered the vaccine, please take it up, because that is what will keep you safe.
Boris Johnson will set out a roadmap for easing restrictions in England on Monday and has promised a cautious approach that will focus on data and not dates. Fergus Walsh, BBC News.